The sixth installment of the EDDY video series will discuss what early intervention is and why it's important.
The purpose of early intervention is to build a strong foundation for a competent communicator, which in the future will allow for an autonomous and confident individual. To be most effective, intervention should take place early. As previously mentioned in this video series, according to EDDY standards, the latest a baby with a known hearing loss should start receiving intervention is 6 months of age. Early is the key word. Therefore, once a child is identified with a hearing loss, they should be referred to early intervention within 2 days of a diagnosis. Children will be placed in a Birth to 3 program, which is federally funded under IDEA Part C. According to a 2011 study by Misen, Wiley, and Daniel, children enrolled before 6 months of age had initially higher language skills and maintained age-appropriate skills over time. Although children entering early intervention after 6 months of age made gains in their language development, the time spent was too brief to provide adequate language catch-up. Early intervention is meant to provide information and emotional support, create goals, and identify timelines for those goals. The interventionist will provide services in the mode of communication the family chooses, whether that is fully oral, fully visual, or a combination of both. Early intervention is heavily geared towards educating and supporting the family. The family will be educated on communication strategies and ways to help provide a language-rich environment. This will influence their child's ability to learn the necessary language skills and also help the parents become confident in parenting a child with a hearing loss. The family has the greatest ability to influence the child's communication development because of the amount of time spent with the child compared to any interventionist coming into the home.
The benefits of early intervention at or before 6 months are numerous and include improved speech and language outcomes for the child, reduced psychological stress, and if amplification is used, the development of the auditory system is closer to normal the earlier amplification and intervention are given. These aspects lead to better long-term benefits for the child and community. Walker et al. Found that even children with mild hearing losses, rather than severe to profound, had measurable benefits from early intervention services, particularly in the area of language development. Parents and families also benefit from early intervention. Early intervention helps parents learn about their child's disability and become familiar with ways to help their child become a competent communicator. When parents choose amplification, early intervention helps them become more comfortable maintaining and using their child's hearing aids or cochlear implants. It also helps parents understand the importance of full-time amplification use, which increases compliance. The consequences of delayed or absent intervention are quite serious. When hearing loss goes untreated, serious speech and language delays occur, since the child is not getting appropriate auditory or visual language input. Intervention that is delayed by only a few months can seriously impact a child's language outcomes, particularly in the areas of vocabulary, sentence structure, and speech production. Once the child is older, lack of intervention results in social, academic, and self-esteem problems. Children usually exhibit isolation from peers at school, unhappiness, and lack of friendship. As far as academic problems, children with unamplified mild to moderate hearing losses were found to be 1 to 4 grade levels behind their peers, and children with severe to profound hearing losses never achieve skills higher than 3rd to 4th grade level. The gap in achievement between children with hearing loss and their hearing peers widens as they progress through school.
As previously mentioned, the physician's role in EDDY is to guide the family through the process. Specifically in regards to early intervention, the physician's role is to check in with the family and be sure they have access to the resources necessary. They should also understand why early intervention is so critical and stress this to the family. In addition, as the medical home for the child and family, the physician should follow up with the family and interventionist periodically to ensure intervention goals and developmental milestones are being met. This is particularly important because, based on a 2004 study by Paris and Rausch, 40% of children with hearing loss have at least one other disability. The physician should continue to stay involved in the child's care and be able to communicate with the IFSP team in order to help facilitate coordinated medical care and offer suggestions and support.